My name is Horatio Thomas, and I'm a PGY3 resident at the University of California, San Francisco. I'm going to be presenting to you our study on our virtual medical student rotation. During COVID-19, there was an expansion of virtual rotations as a way of showing medical students the role of radiation oncology and cancer care, and also recruit medical students to these residency programs. We started a 2-week rotation at our institution, really one to assess its impact on students. We decided to do a mixed method sequential exploratory study design with surveys that were followed by interviews. We invited all the medical students, residents, and faculty who participated in our curriculum to join the study. Med student interviews really focused on the impact on their clinical skills and understanding of department culture and their reception of feedback. And resident and attending surveys really focused on the virtual curriculum's ability to help them incorporate medical students in the clinical space and assess those medical students and give them feedback mentorship. We summarize the surveys with descriptive statistics and are going to do thematic analysis on the interviews. We completed our survey at this point, and we got greater than 70% response rate from all of our population. Medical students, 79%. Notably, 45% applied into radiation oncology in this past cycle, and those who didn't have no interest in applying in the future. Most of the medical students who rotated with us had never rotated in radiation oncology before. If we look at the perspective of medical students and faculty, what we find is that med students were able to really feel like they were able to assess the quality of clinical training, the culture, clinical opportunities, and help them decide on a residency specialty. They did find that it was a little difficult to incorporate themselves, though, really into the clinical care. Nonetheless, they felt like there was a moderate or more improvement in their clinical skills throughout this entire time. When we look at the residents and faculty, they felt like the virtual curriculum is actually worse in most of the clinical domains compared to the in-person rotation. Notably, they noted that they weren't able to really assess residents' clinical preparedness or some of their clinical knowledge. It was interesting, though, that they felt that assessing medical students' interest in scholarly work or the ability to convey scholarly information about radiation oncology is about the same between the virtual setting and the in-person setting. One thing that came out as well is that medical students felt like they had less time with attendings than they would want, but had the same appropriate amount of time with residents. We hope to build on this project by doing semi-structured interviews. This will interview the medical students who volunteer to move forward, the residents and attendings, to really understand the thought process behind their responses and to add additional depth and meaning behind what their experiences were. We also plan to do a financial analysis in order to see what costs were saved the medical students who did not have to come to UCSF for their rotation. So at this point in the work in progress, we conclude that medical students did find that they were able to assess the quality of training, the culture, and explore clinical opportunities that helped them to make a decision about residency specialties. However, there was agreement actually between the three populations that medical students who weren't able to take an active role. It was hard for the residents and attendings to really assess their clinical skills and clinical abilities, and it was hard for med students to really demonstrate it. So we know that we still need some effective strategies for incorporating medical students into these clinical interactions and to model interdisciplinary practice and assess their clinical growth over time. And we hope that our interviews will help to further deepen these responses and also help us to brainstorm additional ideas that we can recommend to our program and the community.